Hello and welcome to the COVID-19 pandemic updates. I'm Kayode Okikiolu. First, the highlights. Ekiti ramps up surveillance as the University of Calabar in Cross River State gets set to enforce preventive measures. The Kwara State government determined to intensify campaign as residents shun vaccination sites. South Africa enters fourth wave of the pandemic as the nation battles to keep the Omicron variant at bay. Thank you for joining us on the program. It's been 3 days since the Nigeria Center for Disease Control, that's the NCDC, reported the first cases of the Omicron variant in Nigeria. And there's been some quiet on the variant ever since as scientists get to work to better understand its transmissibility, how severe it can get, the effectiveness of the current vaccines which we have, as well as other gaps in information and knowledge. Well, this might take some time. I mean, we're dealing with the new variant of the novel coronavirus, as we call it. But that's not to say that we're completely helpless against the virus. We have some vital information for you on the program today. But first, let's take a look at the latest COVID-19 figures.
47 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states and the FCT, indicating a drop from the figures reported earlier. Plateau had the highest number with 16 cases, while the FCT and Rivers had 8 cases each. Gombe and Kaduna had 4 each, Edo and Kanu had 3 cases each, while Bauchi recorded 1 case. The new tally has increased the total confirmed cases in Nigeria to 214,317. 45 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 207,357. No additional deaths from COVID-19 complications were reported in the last 24 hours, keeping the fatality toll at 2,978. Currently, there are close to 4,000 active cases in Nigeria, while over 3.5 million samples have been tested so far. More than 6.8 million eligible Nigerians targeted for the vaccination have received their first dose, while over 3.6 million persons have been fully vaccinated. In Africa, there are more than 8.6 million confirmed cases and over 223,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 264 million, while deaths are beyond 5.2 million.
Well, state governments have also been speaking on the Omicron variant and how they're tweaking their response measures to avert a possible hike. The Ekiti state government, for one, says it is intensifying active surveillance and ramping up testing so as to ensure safety. At the launch of the governor's innovation initiative to improve healthcare services, the State Commissioner for Health says they will always be on guard, while participants at the event describe the pandemic as a challenge that necessitates innovation and adjustments.
I think we've reached a point of very solid active surveillance in Ekiti State. As you now know, we've decentralized testing to over 146 facilities. We are able to pick up any cases as quickly as possible. The other thing I need to point out is we will ramp up, and which we've started doing, our vaccination campaign. We're vaccinating in over 269 sites as I speak. Yeah, just last week, over 25,000 people received their vaccine in Ekiti. Our goal is to continue to improve that number so we get as many people within the eligible population vaccinated.
Use this opportunity to change behaviors. If we, for example, you must have seen in the population that they are now washing their hands more often. We're all wearing masks. Those are behavior changes that before a pandemic would have been very, very difficult to implement. But I think those behavior changes can stay. The washing of the hands and being more careful in how we do things. So it is a big opportunity, I think. That would be my advice, to see it as a difficult time with the opportunity to change the way we do things.
Well, to the education sector, where the Vice-Chancellor of the University of Calabar, Professor Florence Obi, is given the assurance that the institution will reinforce adherence to all COVID-19 protocols in the institution. Well, speaking after inspecting some newly built hostels at the school premises, the Vice-Chancellor emphasized that the institution will do all it takes to ensure that all the protocols are observed by all members. To do this effectively, she promises that the institution will revamp its sensitization campaigns for increased effectiveness.
We are going back to really reactivate and making sure that we go back to our sensitization. We actually got relaxed with time, but the COVID-19 team that we put in place did wonderfully well. And then with the isolation center, which of course we had 2 isolation centers, male and female. By the grace of God, we never used any. And God has been so faithful to us as a university. We had few cases that were even not known to the entire university. The team was able to manage those ones, and thankfully we didn't have any spread. And then with the new variant now, I think the team will go back to board and then re-strategize, and so that we go back to re-sensitizing our students that, look, we should not lose our guard. We should go back to wearing our face masks, go back to maintaining our distance, and possibly we'll continue distributing face masks, as it were, to the students.
Well, let's take a closer look at these public health measures. We're joined on the program this evening by Dr. Jamiu Ganiyu, who is a public health physician. Well, thank you for joining us, Dr. Ganiyu. So far, we have seen some sort of Thank you. We've seen some sort of increased activities at various levels and sectors. I mean, right after the discovery of the Omicron variant here in Nigeria officially. So for the public health sector, I wonder, has anything changed in this past 3 days? Have you sensed some sort of urgency? If you have, then what exactly has changed, perhaps?
Thank you very much for that question. You agree with me that since the discovery of the variant in Nigeria, there will be a lot of steps taken by the government, especially I overheard the Honorable Minister of Health was talking about the need to, step up surveillance at our port of entry. The need to enforce and ensure that we comply with the usual pharmaceutical, non-pharmaceutical measures like the wearing of face masks, maintaining social distancing in public places, avoiding overcrowding, and other measures. I think, and again, there have been issue of also ensuring that we also up our game as regards to genomic surveillance. So there'll be a lot of activities, even including the current, scale up of COVID-19 vaccination in all the public places and even in the private facilities. So there is a lot of concern and a lot of effort have been put in place to actually ensure that the current variant does not pose a public health risk, just like every other variant. Thank you.
To match some of these announcements and statements by, what we see on ground. And that perhaps takes me to my next question. And I'd like to know, Dr. Ganiyu, are we prepared for a fourth wave? I mean, some have said it's inevitable, but I mean, you work in this sector on a daily basis. You sort of know this inside and outside. So in terms of our capacity, our ability to respond, the equipment we have, even welfare for workers, because that's also a very important point, and we've seen that play up in recent times. Are we prepared, really, for a fourth wave?
I will say we are prepared, but on the issue of welfare, we want to say much as regards to that. But you agree with me that we've built a lot of capacities in terms of training of health workers, in terms of ensuring that there are appropriate infrastructures. So we still have our health workers on ground, those that have been involved in the response since we had the first case last year. So we'll just leverage on what is on ground currently. So I want to believe we are prepared. And if I've not been to the airport, but there have been a lot of reports that we've actually, step our game as regards to surveillance at the port of entry. And even today, there was a release of a revised protocols on issue of that has to do with travels. Initially, we don't used to request for 2 PCR when somebody is coming into the country. Now we now have 48 hours of PCR testing and a repeat after 7 days. And they need to actually ensure that they comply with that, for especially for every traveler that's coming to the country, must ensure that he or she is being isolated. So there have been a lot of things on ground, and I want to believe the government is on it on that level of trying to ensure that we actually prevent the fourth wave. But as regards to the welfare, I don't want to say much. There have been a lot of issues back and forth about hazard allowances and so on. And based on what I read, that the review will continue next week. So I won't be able to comment on that, but I want to believe in terms of what we've been able, based on our past experience, I think we are prepared for the fourth wave. And a lot of implementation is on ground to ensure that it is being averted in the country. Thank you.
Well, we certainly hope so. I mean, that's what we all look forward to, right? But let's talk vaccination. I mean, we've been showing pictures of people getting vaccinated and the rest, and that's one of the major activities we're seeing in recent times. But from where you sit, from what you experience on a daily basis, are you seeing a surge in people coming out to get vaccinated? And more importantly, are those centers able to meet the demand? Because we've had reports time and again, people going to get vaccinated, some for even their second shots, and they're turned back. So how is that playing out?
Well, I want to believe that we've moved from that level at the moment. It was initially we have cases of people not getting second jab. But I want to believe it now. For the past 1 or 2 weeks now, Nigeria has witnessed different support as regards to supply of vaccines. Even I was reading it today, Germany just committed about 5 million. So I want to believe that the issue of availability is no longer the issue. The issue is how we're going to create demand. So how we at this juncture advise for government to actually devise a more innovative way to ensure that actually we create demand. And I will suggest, for instance, apart from scaling up, we must ensure that we actually let people appreciate the need for that vaccine. That should not be only restricted to the urban areas alone. How about our rural settings? So we need to actually create appropriate awareness at the grassroots, at the community level. And as I've said, we have all the structure on ground. It's just for us to leverage on it. For instance, we have CAN, Christian Association of Nigeria. We have the Islamic, the Association for the Muslims in the country. So we can leverage on. Through that process, we can get as much as one number of people that can get vaccinated. I will also appreciate if you can also look at the celebrities, like people, all the musicians. They have a lot of followers, so we can actually collaborate with them so that we can create demand. I want to believe our problem that is not issue of availability or affordability. It has to do with how we create demand so that people can get, we can have adequate coverage as regards to vaccination. Yes.
Dr. Jamiu Ganiyu, quite important points you have made, and we'd like to thank you so much for sharing your thoughts with us on the program. Dr. Jamiu Ganiyu is a public health physician. Thank you.
Thank you very much.
We'll go on a break now. When we return, we have stories for you from South Africa and Germany. Just stay with us. Welcome back. We pick it up where we left off with vaccination. And as the Kwara State government commences vigorous COVID-19 vaccination across the state, a lack of awareness and fear of side effects have been identified as factors responsible for low turnout. At the Kwara State Stadium, which is one of the venues for the exercise, only few people turn up for vaccination.
As part of efforts to ensure that most residents in Kwara State are vaccinated against COVID-19, the state government has sent teams to various locations. At the stadium, which has a capacity to vaccinate 500 people daily, only about 30 people turn up.
We vaccinated like 30 people this morning. We are vaccinating all Kwarans, not only the civil servants. We are vaccinating everybody. We want all Kwarans to come out and get themselves vaccinated.
Some residents have decided to trust the process.
I'm here. I know that the moment I came here to get vaccinated, I will be protected. So that's why I'm here. Every other drug that we are taking for ailment are subjected to WHO's verification and confirmation. And then if such a body has already confirmed that COVID-19 is good for human, why should I say no to it?
This lady, who was initially skeptical about the vaccine, decided to give it a try.
I'm very good. I'm okay, as you can see.
Vaccination officials say the vaccines are available for all residents, not just civil servants, and they aim to put more efforts into making sure people are aware.
Well, outside Nigeria now, South Africa has officially entered its fourth wave of the pandemic, with more cases reported in the 9 provinces. The Minister of Health, Dr. Joe Pala, in a media briefing says the country has seen a steep rise in infections over the past week and encouraged South Africans to get vaccinated and adhere to safety measures. This is coming a week after scientists in the country discovered the new COVID-19 variant, Omicron.
We have moved from a total of around 2,465 new cases last Thursday when this variant was announced to yesterday's highs of 11,535 yesterday afternoon, a rise of just over 9,000 new cases per day within 7 days. Over the last 7 days, the new spike has moved into the whole of Gauteng, and it's also registering presence in all our 9 provinces, with numbers starting to rise in the Western Cape, in KZN, in Limpopo, in the Northwest, and in Mpumalanga, also with high positivity rates. Currently, only the Free State and the Northern Cape are still showing relatively low numbers and low positivity rates. We want to appeal to all South Africans that the time is now for more vigilance, to apply all our tried and tested health and safety measures, which we know very well, which our president also has emphasized on Sunday. That is the wearing of masks, hand washing, sanitizing, physical distance, avoiding crowds, and also being in areas which are well ventilated. Above all these measures, the main opportunity now, which is different from when we had the other waves, especially the first and second wave, is that we have opportunity to be vaccinated, which provides a major protection against serious illness.
Well, outside Africa to Germany now, where there are plans to introduce harsh new restrictions on unvaccinated people as the nation continues to battle a fourth wave of coronavirus infections. We're joined by DW correspondent Chelsea Delaney for more. She joins us from Berlin. Now, Chelsea, these new rules, in fact, people are calling them a lockdown on the unvaccinated. So what exactly is going to change with these new rules?
Well, this will mean big changes for the unvaccinated here in Germany. They effectively will be cut off from big parts of public life. These new rules mean that people who haven't been vaccinated or recovered will no longer be able to go to, for example, restaurants or theaters as well. They won't be able to go to retail stores except for essential places like supermarkets or pharmacies. The other big discussion that is being had here in Germany right now is an overall vaccine mandate. So this is something that Germany has been very hesitant to introduce throughout the pandemic, but given the situation here right now, the severity of this outbreak, more politicians are coming behind this. So far, what we've heard is that they will introduce a vaccine mandate for people working in places like hospitals or care homes, but they will in the coming weeks discuss a broader mandate that would impact everybody.
So is there any evidence that the prospect of stricter rules is encouraging people to get vaccinated?
Well, so far we haven't seen a huge shift in the number of people taking up a first or second dose of the COVID vaccines. What we have seen is a huge push for booster shots here in Germany. So right now we're administering almost 1 million shots a day, but about 83% of those are booster shots. So the prospect of these stricter rules or a vaccine mandate hasn't really done much to turn the needle in terms of people wanting to get vaccinated. Obviously, that could change as the prospect of being cut off from social life or losing your job becomes more real in the months ahead. The other thing that the government is really pushing right now is to make it easier for people to get vaccines. So they want to administer about 30 million doses by between mid-November and the end of the year. And they're hoping to do that by really broadening the network of doctors or even pharmacists that can give out these shots, just to make it less bureaucratic and lower wait times for people. But right now, the vaccination rate here in Germany is still under 70%, which is really unideal given the severity of this outbreak.
So now to the new variant on the block, Chelsea, Omicron. Berlin yesterday confirmed its first case. So how widely is it spreading there?
Well, Berlin has already actually confirmed 2 cases of the Omicron variant here, and scientists say that it likely is spreading more than those numbers indicate, because there was likely a period before the Omicron variant was detected when people were traveling and spreading it. So they say that we could already have numbers in the hundreds of this variant here. The cases that we have seen are from travelers who have recently returned from South Africa. Some have been fully vaccinated, which will obviously raise concerns about breakthrough infections, but scientists are really cautioning that there's still so much we don't know about the Omicron variant, how infectious it is, how dangerous it is. So that is really going to determine how big of a problem this is for Germany and its 4th wave of infections.
Well, thanks for that update, Chelsea. We'll have more updates for you on the Global Update.
While the World Health Organization says it's still studying the transmissibility and severity of the new variant, it says makers of COVID-19 vaccines should gear up for the likelihood of needing to adjust their products to protect against the Omicron variant.
Now, it's very recommendable that vaccine manufacturers already start planning ahead and plan for the likelihood of having to adjust the vaccine, the existing vaccine. That's good. Not just to wait till the final alarm bell rings. We do not yet have information together. And we said a week ago that will take 2-3 weeks. Now that was a week ago. So it will still take some time. And let's not rush into conclusions here. Preliminary data, and we've said that now since a while, show that there's higher transmissibility. But that's all what we basically have so far. Again, different areas, different reports have individual pieces of information, but that's, I would call it right now, an observation of that moment, of that particular area. We need all this together to make a careful assessment.
Meanwhile, the WHO says Asia-Pacific countries must prepare for a new surge in COVID-19 cases led by the new strain and remain vigilant.
COVID-19 has now spread all over the world, and we should not be surprised to see more surges in the future. As long as transmission continues, the virus can continue to mutate as the emergence of Omicron demonstrates, reminding us of the need to stay vigilant. Border controls can delay the virus coming in and buy time, but every country and every community must prepare for new surges in cases.
The new variant has been reported in at least 24 countries. Many governments have responded by tightening travel rules. Malaysia is one of the latest countries to detect its first case of the new strain in a foreign student who was quarantined after arrival from South Africa 2 weeks ago. And over in the United States, New York has found 5 cases of the new strain, becoming the 4th U.S. state to detect the variant and bringing the total number of reported infections in the country to 8.
Do visit our website, channelstv.com, for more updates and better understanding of the pandemic, plus other stories, all at your fingertips. Just before we go, on a programming note, a special town hall on the advocacy to create more seats for women in the National and State Assemblies comes up at 7 p.m. across all the station's platform tonight. The program replaces our political program, Politics Today. So in just a little over 30 minutes, we'll be bringing you a special town hall on the advocacy to create more seats for women in the country's national and state assemblies by 7 p.m. And that's across all our platforms. So don't miss it. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikelu. Always remember to stay safe.